Hello, Gold viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold Learning. And I'm chatting today with Zainab Yate about an upcoming presentation here at the Gold Online Conference, the Gold Lactation Online Conference of 2022. Welcome, Zainab.
Hi, Kristen. It's nice to be back.
Yeah, it's nice to have you back, and back by popular demand. You are here at Gold. It's wonderful to have you here and sitting down here with you. Before we go into the actual presentation that you have here with us titled Research, Ethics, and Infant Feeding, how to utilize the 4Ds of a brief assessment. A very interesting title there. Tell us a little bit about yourself. First of all, where in the world are you?
So I'm just outside London at the moment in the UK, and it's pretty cold actually still. And this is where I've been for a good couple of decades now. So it's what I call home.
Wonderful. Thank you for sharing that. You are a biomedical ethicist and your specialized interest is in infant feeding. So give us a little overview about your background.
So I was always interested in ethics. Going through school, I didn't realize there was a sort of topic about biomedical ethics. I have a long personal history with medical interventions, and so I was always really struck by the questions it can raise. And I went on to study biomedical ethics and law as a master's degree, and I started a PhD in it, but it was a different subject completely to infant feeding. It was a substance misuse. But then I fell pregnant, and as many people might recognize, it and pregnancy really became the focal part of my life. And so I sort of shifted focus of my work into areas of maternal health, breastfeeding, lactation, and I think there's a lot of crossover with ethics in terms of the questions it raises. But I've been in research ethics for perhaps about 15 years or more. And it's really shocking actually when you learn about how it impacts infant feeding and lactation. And I really wanted to share what I'd learned over the years in terms of clinical practice and evidence-based research.
Your work is so very important, especially for the field of infant feeding. We're dealing with tiny, vulnerable little ones, right?
Mm.
So in there, as you mentioned, there is so much to consider. There is such a lot going on, and there's where research comes in, right? Research is so very important, and now with the internet, we have more resources available for us to even as practitioners or even as lay people to access research, right? You will talk about that in your presentation there as well, but research, many of us are interested and passionate about learning more, but it's not always the easiest to read and to focus on. Especially there is so much, it's like it feels like every day there's new articles coming out, and to sift through and what to find really what is applicable, what is the right thing here for me, is not always easy. Do you have any tips there for us?
Well, the whole presentation actually was born of the fact that I had to do that myself,
Oh.
often multiple times a day. So as part of my my chairing the research ethics committee panel, we have to read hundreds of research protocols, and part of that is to check the published research. And I did myself struggle. So I essentially came up with, I think, the 4 leading quick things that you can scan for, that you would be able to take further, whether this research is something that is either applicable to your field, whether it's actually relevant and up to date, because we know that lots of theories are superseded, and often we can have new research supplant old research and prove it incorrect. And the main thing is just to know that you can trust it in a sense. So you have to really know motivations, conflicts of interests, and whether the research is robust enough for you to use. And so I think the presentation is really going to give you a good grasp of having a quick scan of articles, even in books, to be honest, for you to realize quite quickly if you're able to utilize the findings of that research.
That is actually brilliant and so super helpful, because many of us, you have a variety of professionals out there, right? We have the lactation professionals that are super busy in clinical practice, and they say, I need to stay up to date with the latest research, but I'm really so pressed for time. I'm out there, helping these families, but I need to know what's out there. So give me some like the 4Ds that I can utilize. And then you have people, and I'm belonging to that category a little bit like that, who see new research coming out, and I see that shiny new thing, and oh, this one and that one, and I have a little trouble focusing on all that. And then, it's hard to find, okay, what you mentioned, is this really relevant? Is this really where's this, how was this generated? What's behind it? And going a little deeper into not just seeing the latest newest thing that just came out, but really, is this robust, is this applicable?
Exactly.
And so on, because with the information overload that we're experiencing sometimes, it's very easy to hop from one to the next thinking, we are looking at good robust research, when really maybe it's not the case. So thank you for putting that together for us here as well. That's wonderful. Thank you so much. I had a glance on your presentation a little bit. They were quite, and you mentioned it just talking earlier here, that some things were quite shocking that you discovered, right?
Yes, I'll go into quite a bit of detail in the presentation, but I think over the years, it's surprising how many different specialisms in healthcare are really unaware of the very basics of human lactation and infant feeding and maternal mental health and maternal health needs. So I've come across plenty of studies before they've been given ethical approval to go ahead that really had some very, very worrying approaches in their research protocol, that, because I was someone that had the basic knowledge of human lactation and infant feeding, I was able to question, I was able to make some suggestions, and in some cases, when it was quite dire, to put some conditions on the research. For example, if you are going to consider this a variable, then we won't allow you to continue this research or start it, because it would compromise, as you say, very vulnerable infants or vulnerable women on a maternal ward. And then, of course, the other area is, and we're all quite familiar with it if we're in this field, is those who are in the artificial milk world, so to speak. And they have a very particular set of characteristics when they're applying to do research, and also how they present their research. And I think it's fascinating to understand how they go about it, and then how they use their findings in marketing their products. So it will give you another element of, how the WHO code is broken and where they are able to cite their claims from, because often it's from their own research. So how do you get it from evidence-based research to say this is closer to breast milk, or this is natural, or this is better for a child? You see, these kind of statements come from published research often.
And the problem with that also is that these entities are often very well funded, right? They have abundant financial backings that they can utilize and turn into something that looks good, and use it then for their marketing, where other entities have absolutely no chance to compete with, because they don't have that financial backing, the financial resources, just to publish all their their research there, and get the word out there further as well.
Definitely, but I think if you listen to my presentation, I think you really will feel empowered afterwards, whether you're a researcher or a clinician, to just be able to challenge a research paper by a large company that has a big conflict of interest, but challenge it on quite logical, factual ground very quickly, actually. you might be able to see that their definition of breastfeeding isn't actually what would be considered exclusive breastfeeding by the World Health Organization. And so therefore, a lot of their conclusions or any of their findings would be subject to quite a lot of scrutiny. And then you'd be able to apply that yourself just by the own standards of that we have in our research, community.
Absolutely wonderful. I can't wait for this presentation. It's going to be so valuable, not only for seasoned professionals, but also for students out there, who are just learning to kind of looking into research and what to look for. So it's relevant for everyone, no matter where you are in your lactation professional journey, right, Zainab?
Yeah, definitely.
Beautiful. Before I let you go, I quickly want to talk about your book. It's pivoting to a little bit different area here, but I think it's such a beautiful research that I feel like a resource that is available, that you made available. So please talk about your book here, When Breastfeeding Sucks.
Oh, well, so yeah, as you mentioned, it's not, I mean, there's some crossovers with ethics. I do question some things in the book about autonomy and consent, but mainly it's looking at the phenomena of when breastfeeding triggers negative emotions. And it's my sort of baby. And it was born out of a need because there's no real resources or evidence-based literature on it enough for you to say, here, this is something that can help you understand, or here, why don't you try this? This might reduce the negative feelings or help you come to terms with them, or even possibly to find the underlying causes for them. And yeah, I'm really glad it got published. It's with Pinter and Martin, and it was just, I think, a year or two ago now. So it's been a long road, but I've heard many good things about it, and I'm just glad it's out there. Hopefully someone can pick it up and do some more research to look at different sort of medical conditions and different risk factors, and understand, aversion in relation to other infant feeding challenges. So I would, yeah.
It is a really, really great resource. I can highly recommend it. Very helpful, especially, also also for families, knowing this is something real. This is not just me. This is something,
Oh yeah.
that that is out there, that and for lactation professionals to take this also and say, like, look, this is what the research says. This is what it is, and very beneficial. So thank you so much for that. And thank you. Yeah.
It's been great. Thank you.
And thank you for sitting down here with me, talking to me about, the upcoming presentation titled Research Ethics in Infant Feeding, How to Utilize the 4Ds on a Brief Assessment here. And that will be part of the GOLD Lactation Online Conference that we will get started with on April 4th. And this presentation will be live on April 12th. And this is for all our viewers. Everything is always recorded. So if you can't make it to the live, the presentations will be there for you, recorded, and you can watch them at your convenience. And if you would like to find out more about this presentation here and the other presentations of the conference, we invite you to visit goldlactation.com. Thank you everyone for watching. Bye-bye.